Hello and welcome back to this falls prevention series where we take a few minutes each day to learn how to give falls a slip. Again, my name is Marna Wright and I'm an occupational therapist who's worked with home health patients since 2014 to help them return to their previous level of function, often after a fall. Falls prevention and teaching falls prevention has now become a passion of mine, as has sharing what I've learned about falls and fall prevention onto others, in the hope that it can help you prevent a first fall or a next fall and any injuries from falls from happening to you or a loved one. In Module 2, we went over a brief list of falls risk factors. Today, I'd like to start by focusing, sorry, I couldn't help that one, on a list of common visual deficits that can put a person at an increased risk for falling. Again, this is a finite list of more common visual deficits, but if you think of more that you'd like to see me cover, put them in the comments below this video and I'd be happy to in the future. First off, we have poor visual acuity. Remember, when the brain gets a clear message from the eyes, the inner ears, and certain cells in our joints, skin, and muscles of where our body and head are in space and in relation to our environment, our brain knows what directions to give our body to help us maneuver in that environment and keep our balance. Any condition that affects one of those systems will make it harder for the brain to get a clear picture with which to manage the body. So poor visual acuity from any condition is a personal fall risk factor. Second, we have reduced contrast sensitivity. Sometimes it's hard for people to tell where the floor ends and the wall begins if the colors are the same, or where one step ends and the next begins if the stairs are the same color, or how far to clear their foot to step over a white tub into a white floor of their shower. This puts them at risk for falls, especially at any transition point from one surface to another or when the environment is darker. Similarly, anyone who has lost depth perception might not be able to tell how close they are to a surface level change or how far down that next step is, and they would require a railing to balance those activities. Anyone who has sensitivity to glare can miss items in their environment that might cause a fall if the lighting is too bright. Have you ever driven at night and the glare of your windshield makes it difficult to see the road and other cars? This can happen in the day-to-day lives of persons with sensitivity to glare. Many eye and brain conditions can cause us to have a reduced visual field size or visual field cut from the left or the right or below or above, or tunnel vision from all directions. These people will not necessarily know they cannot see items below their knees because remember, it's our brain that really sees after interpreting sensory input from our eyes, and our brain will try to fill in the blanks from that information to be helpful from the information that's been given. So if the eyes did not tell the brain that there is a coffee table 3 feet below the brain will interpret a room without a coffee table. These people will often trip and fall over items, fall to the left or the right, tell their family members to stop moving everything around, and depending on the level or type of damage in their brain, they might actually ignore all parts of the environment or their bodies on the left or the right side. Blurred vision is like sensitivity to glare, but it never goes away. And it's difficult to see how to safely maneuver in an environment you cannot clearly see, which just makes sense. Finally, if you have difficulty adjusting to changes in light, you would be at highest risk for falls after stepping into or out of a dark room to a bright outside environment. Remember also that all these visual impairments make one more at risk for falls in their own homes that they have mapped out hour after hour, year after year. Imagine how much more at risk for falling these visual impairments can make a person in a new or novel environment, especially one that has differences in terrain, and levels. Oh, that's better. Remember, the purpose of this series is not to scare you. No, it's to empower you, to prevent a fall from occurring to you due to your risk factors. If you have any of the above visual deficits, here are a few steps you can do to prevent a fall from a visual deficit. If you have poor visual acuity, it's essential you go for your regular eye exams. Wear and clean any prescription glasses regularly. If you are prescribed bifocals, but you can afford to have a prescription for walking and a separate prescription for reading, that will make it easier to clearly see your environment during mobility. And if you notice visual disturbances with medications, for example, some sleep medications, report these to your prescriber. In fact, report any of these symptoms below to your prescriber on a regular basis. If you have reduced contrast sensitivity, built into your environment lots of contrast. For example, add black tape to the edge of stairs or get a non-slip mat for your tub in a dark color to contrast from your white tub. Paint your walls a very different color from the color of your floor or from your strips along the level of your wall. If you have impaired depth perception, you too will benefit from visual cues from one stair to another with contrast sensitivity, and you can incorporate your other senses to help you by adding railings to stairs and using a grab bar in the bathroom to transfer in and out of your tub or shower. If you're in public with a loved one, ask them to give you a heads up of curb cuts or stairs or even slight surface changes that are coming up so your brain can be informed of them. Sensitivity to glare? Keep regular but low lighting in each room of your home, and you may need to give yourself time to adjust from a dark room, for example, to a sunny outdoors, like persons who have difficulty adjusting to changes in light. If you have difficulty adjusting to changes in light, you may want to consider some transition lenses as well. If you are aware of, or even if you don't and are not aware of any visual cuts, I often teach my clients to look before they leap, especially when entering a new room or before standing from a lying or a seated position. Turn your head, take a few minutes or seconds, and really look around. Is there a blanket still wrapped around your foot from the bed? Is there a water bottle you put on the floor to take to the kitchen when you get up but you forgot about? Is that your kitten or puppy sleeping by your feet? Take a few seconds to turn your head from left to right and up and down slightly to use your intact visual fields to compensate for any missing ones. Blurred vision? Get regular checkups and report that symptom. It can be a symptom of many treatable conditions, but you want to report that early before permanent changes occur, such as with diabetic retinopathy that goes untreated from diabetes. That's it today. But if you have stayed this long, I thank you and hope this short training on visual deficits and what you can do to prevent a fall from them has helped you or will help a loved one learn how to give falls a slip. For any follow-up questions you may have regarding the content presented today, you can email me at marnaby243@yahoo.com. Thank you.